Hello, ladies and gentlemen, doctors and healthcare professionals. My name is Andy Jin.
And I'm Peter Zhu.
Today, we will present our systematic review and meta-analysis on the effectiveness of traditional Chinese and Western SSE and practices for treating adult idiopathic scoliosis.
Before we begin, we'd like to declare no conflict of interest in this study. We care about this topic in particular because most research currently is focused on adolescent scoliosis treatments and severe scoliosis treatments where the Cobb angle is greater than 30 degrees. But there's a lot of people around the world who have mild scoliosis, and there needs to be more information on if they can do something and what they can do to improve that.
For this study, we're focusing on three major schools of treatment. First is the Schroth method. The second is SSE, which stands for Scientific Exercise Approach to Scoliosis. And the final method is traditional Chinese medicine, which consists of various forms of practices, including moxibustion, acupuncture, and cupping.
The research process for this meta-analysis involved pulling papers from three databases: Google Scholar, Baidu Scholar, and iShushu, funneling down to 12 qualified studies.
Moving on to the results. The following is a portion of our results table. For each study we examined, we noted the sample size, type, and size of presenting spinal curves, intervention method, as well as the patient outcomes.
We did statistical testing of the collected data and produced a forest plot indicating whether each method favored non-surgical intervention or regular intervention, which is no treatment. As you can see, all three methods favored non-surgical intervention.
Moving on to the discussion, we found that all 12 studies reported a decrease in Cobb angle after their respective treatment, ranging from 3 degrees all the way to 11 degrees. We also noted that the mean treatment duration of TCM methods is much lower than Schroth and SSE, with an average time of 8.5 weeks versus 39 weeks and 105 weeks respectively.
A couple of limitations in the study includes a lack of clinical research on exercise treatments in adult scoliosis and higher risks of bias from TCM studies, as they were often published in less reputable journals and didn't have a clear methodology.
The limitations suggest that further investigation into the effects of various SSE and practices must be conducted to validate effectiveness and to increase confidence for clinical recommendation. Furthermore, it will be worthwhile to study the relationship between the duration of TCM methods and decreasing Cobb angle and see whether it really is a quick fix alternative compared to Western methods.
Thank you everyone for watching our presentation. We hope you enjoyed it.